But what do I know? I'm just a vagina doctor.
Hi, how are you?
I'm great. How are you?
I'm good.
Good, not great?
I'm pretty good, yes. We always want to touch on things that kind of come through on our consult with me's from the office.
Yeah.
And there's always a lot of questions, but sometimes we'll do a podcast like the one we did on Rectocele recently,
Yeah.
which got a lot of play and a lot of comments. So I wanted to go into Cystocele because we did bring that up. We said we'd talk about it at a later time.
And I guess this is the later time.
Yep, it's interesting on the YouTube because some of these short topics we do get so much play because people are searching, what is Rectocele? What is Cystocele? On YouTube, they're searching.
Yeah.
I thought because of that, we should go into Cystocele. Okay?
Yep, absolutely.
Dr. Turner, what is Cystocele?
As opposed to a rectocele.
Go.
Cystocele is, by definition, a relaxation of the supports of the bladder. So the anterior wall of the vagina is deviated downward, and there'd be a bulging in that aspect of the vaginal tissue.
What causes that?
Lack of support of the bladder is usually due to weight gain, or more importantly, vaginal deliveries with some tearing or stretching of the fibrous tissue that holds everything together, or excessive training with weights. So
is it from bearing down?
It's from bearing down. So chronic constipation will do that also.
Okay.
But all of those things will contribute, as will genetics. So if pelvic floor relaxation there's a history in your family, just don't wait very long because it can happen to you. Now, it's not always symptomatic. It can just be found on examination and acknowledged at that point. But if the patient doesn't have any symptoms, you don't need to do anything. But symptoms can be pressure or bulging, or can be urinary incontinence because of that. But one has to be very cautious about repair, which is usually surgery. If repair is necessary, in other words, if the patient is significantly symptomatic, repair is probably the best thing to do. But one has to be careful because if you support the bladder, then you may change the angle between the bladder and the urethra and precipitate incontinence. So you've got to be sure that is addressed at the same time. What it means basically is that you should go to a surgeon who does a lot of these procedures.
Like a urogyne?
Like a urogyne, yeah.
Okay.
And that's a fairly straightforward surgery and a reasonable recovery, but it's still 6 weeks of diminished exercise and no intercourse for that time usually as well.
And what would someone feel if they had this condition?
Either pressure.
Like heaviness?
Yeah, just acknowledgement of something feeling a little awry. Or even there can be bulging of the cystocele through the vaginal opening.
Okay, so the patients that call up and say, I feel like everything is falling out.
That could be the reason.
Okay, because we do get that call.
We do.
I was taking a shower and everything's falling out. That was one call.
That's not a laughing matter.
I know. I was like, wow, you're kidding me. What?
So that requires an exam and surgery if appropriate.
Okay. Great. Thank
You're welcome.
you.
But what do I know? I'm just a vagina doctor.